Okay, good afternoon, everyone. My name is Dinis Nguenha. I am a medical doctor. I am from Mozambique. I am the site PI of the project AFRICAI-RI, in which we're now involved. I was invited to give this webinar today with the title From Medical Images to Clinical Decisions, the Role of AI in African Healthcare. So, throughout my presentation, I will use the short form AI to say artificial intelligence. So just bear in mind, AI is artificial intelligence. So today I will speak about AI in medical imaging, but with a particular focus on African healthcare and respiratory diseases such as tuberculosis and pneumonia. So I will keep this presentation practical. I will present the challenge, what AI can do, and how AFRICA-RI project will respond to those challenges. So I will start with why this topic matters. So this slide introduces the main question that we want to try to answer here. How can AI help move from medical images to better clinical decisions? So as we know, in many African healthcare settings, images can be taken, but timely interpretation by a specialist is still limited. So as a practical example, we have this chest X-ray that is depicted here, where AI can help us identify an abnormal chest X-ray, also can help us know the extension of this abnormality, and also can help us identify patients who need further testing. However, the key message here is that AI should support clinicians, not replace them in the field. So let us first look at the diagnostic gap we are trying to address here. So as we know, millions of people need medical imaging, especially for diseases like TB and pneumonia. In this picture here, we can see the burden of tuberculosis in Africa, which is high, especially in the sub-Saharan region. So the challenge is that images may be taken, but the interpretation and action can be delayed because we don't have specialists in the field. So the question for today is, can AI help us reduce this gap? But reducing this gap, we're meaning not by replacing clinicians, but by helping them review images faster and decide which patients need attention first. So now let us look at a diagnostic pathway. So the demand for imaging is increasing, especially for screening, diagnosing, and follow-up. Specialist interpretation is often limited and is mostly concentrated in large urban hospitals. But in our settings in Africa, we've seen that many patients, they attend peripheral or rural health facilities. So these can create delays between the patient, the image, the diagnosis, and treatment. And AI may help us supporting faster image review and helping identify patients who need more attention. So before discussing AI in more detail, let us clarify what medical imaging includes. So in this slide, I bring a variety of image modalities. There's more than this, just an example that I brought here, that there's chest X-ray, there's ultrasound, CT scan, MRI, digital pathology, and retinal imaging. And each modality here answers a different clinical question. However, for this talk today, I will focus more on chest X-ray and ultrasound, as these two modalities are really relevant for TB and pneumonia. So now let us see what AI can do with these images. So AI can help us answer different questions from an image. It can help us estimate if the image is normal or abnormal, where is the problem, how extensive is it. And also AI can help us estimate the risk. It can help us monitor change over time on the image and also can support clinical decision. So, however, the results must still be assessed with symptoms and microbiology. So the next question is, how does AI fit into patient care? So AI is one step of the clinical pathway. It is not a standalone decision maker. So the pathway, clinical pathway is really simple. It starts from patient, then an image, quality check, AI output, clinician review, and decision. So the AI output, it might be a heat map, it can be a score, or maybe an alert. But these must be assessed together with symptoms. The history of the patient, the tests, and also local guidelines are really important here. So the final decision to test, to treat, to refer or follow up the patient, that decision remain with the clinician. This is what we call like in clinical human in the loop. So let us now apply this idea in our specific example as TB. So in tuberculosis, we can use AI-assisted chest X-ray to support screening or triage. In the bottom left, we have like an image as an example of the CAT4TB, which is an AI output in which it can give us, it can read an image and give an answer as a heat map or a TB score, as we see here. It's a little bit small, but I think you can see here 0.87. And also it can give us if this image is suggestive of TB or not. However, this result is not a diagnosis of TB alone. The clinician still needs to assess this patient, still need to ask for microbiological confirmation, such as gene expert. So this kind of AI can be useful in community screening, primary care facilities in Africa, and high burden settings as our rural settings here. So it's useful, but it doesn't decide the diagnosis. It only supports the clinicians to have patients who need priority in care. So TB is one of the important use case, but also the same imaging infrastructure can support other diseases. So once we build digital storage, we build data governance, local validation, and clinical workflow. This infrastructure can be used for other diseases, to support other diseases. For example, it can be used to diagnose pneumonia, breast cancer, stroke, retinal diseases, and cervical cancer screening. So TB can be the starting point, but is not the end point. So far here, we've seen like why AI may be useful. Imaging demand is increasing in Africa, but specialist capacity is very limited. And however, AI also brings risk. This is why we need a trustworthy AI. So in this slide here, I show how we need trustworthy AI, in which is built in two pillars. One is a strong foundation, in which we need to have good data, digital infrastructure, local validation is really important, and regulation, and also need responsible use. We need clear outputs, safety, fairness, and privacy. So here, the artificial intelligence is not just like an algorithm. It needs like evidence, governance, and clinical oversight. So one key part of the trustworthy AI is local validation. That is the crucial step, local validation. So will AI work in our settings? So local validation asks this simple question. Will this AI tool work with our patients, equipment, and our local workflow? So a tool that works well in one hospital or country may not work in Mozambique, for instance, may well not work in another country, or might not work the same way in another setting. So that is why we need local data, local clinicians, and local ownership before routine use. So this is the exactly gap that our project AFRICAI-RI is trying to address. We want to build the local infrastructure, sorry, here, we want to build local infrastructure. We need to build local data capacity and local validation for imaging AI in Africa. So in this slide, I will present our project in which we're working, the AFRICAI-RI, in which this is like a research infrastructure for biomedical imaging and AI in respiratory care in Africa. This project, it focused mainly in diagnosing two diseases, which is TB and pneumonia. And the main objective of this project is to organize imaging data securely. It wants to support AI development and validation, and wants to enable collaboration between institutions. So the project brings together partners from Europe, as we see here down, for partners from Europe and partners from Africa. These are the countries in which data collection and validation will happen. So most importantly for this project is not just about one AI model. It is about building conditions for responsible African-led imaging AI research. So the project is organized into different work package covering engagement, stakeholder engagement, image platform, data submission, AI use cases, capacity building, and outreach. So these all work package are connected. Data is fed into the platform. The platform supports AI use cases, and validation generates evidence. So now let us now make the imaging platform more practical. So this is the image platform the project relies on. This image platform helps us organize, access, and analyze medical imaging data securely. And also, it does not only store imaging, we also want to support metadata, labels, quality control, and AI tools and governance process. So this platform will allow us to collaborate all partners while respecting local data ownership and governance. Data, it doesn't leave the country. It remains in the country. Only the models that we share, they will be shared within the consortium countries. So with this infrastructure, the project focus on specific AI use cases. So this project has 4 AI use cases. The 4 are respiratory imaging AI use cases. We have 2 in orange, these 2 first here, that use chest X-ray to help diagnose TB in adults, and other to help diagnose TB in children. And the other 2 use case for chest ultrasound is to help diagnosing TB in adults and helping diagnose pneumonia in children. So as you see in the table below, this is how many data this study aims to collect throughout the time that it will be operating. So we aim to collect over 70,000 images, digital chest X-ray and chest ultrasounds, and we can see each country how much data it will contribute for this study. So each use case here is a different clinical question. So each one needs its own data, validation, and interpretation. So the next slide shows the image data behind these use cases. So we will be collecting a variety of images from different countries, different age groups, different diseases, sites, and machines. So this diversity is really important for us because it will help us test whether AI works well across different settings. And after organizing all this data, we can start generating evidence. So in this slide, I bring examples of some projects that are occurring now in Africa. One is AI for HF, in which focuses on AI-powered cardiac ultrasound to support heart failure and cardiovascular assessment through automated or assisted ultrasound interpretation. And other project is AI Mix. This project focuses on AI-powered obstetric ultrasound. It aims to improve maternal and fetal assessment, especially where specialist ultrasound expertise is limited, like in our context in Africa. And then we have our project AFRICAI-RI, in which we use chest ultrasound and X-ray imaging to diagnose TB and pneumonia. So here, briefly, I can bring in an update of our project. Our project is still in the initial phase for implementation. We're still applying for ethical approvals. Some sites, they've already have these approvals, other sites still on the process. And then we plan to start data collection, I think between maybe September, October this year. And then the project will hold its first annual meeting in the Gambia in October to discuss further implementation issues. So to conclude, I would say that AI can support medical imaging in African healthcare settings, especially for diseases such as tuberculosis and pneumonia. But we need to be cautious here. AI must be integrated into real clinical pathways. It should support clinicians, not replace them. It's a tool to guide us on prioritizing patients for care. But AI cannot be a standalone diagnostic tool. So for AI to be useful and safe, we need local validation, good governance, and African leadership. Thank you. I think, yeah, that's all I had to share with you today.